Welcome back to the Morning Brief, and it's time now to talk about the children, our children. We love our children, right? But what do we do to reflect that love? You know, for many, it's a no-brainer. If you can't take care of them, then don't bring them into the world. No, but what's the state of our children's health? Joining us to have this conversation on the program this morning is Mr. Eduardo Celades. He's the Chief of Health, Unicef Nigeria Country Office. Thank you so much for joining us on the Morning Brief. You're welcome to the program.
Thank you very much for inviting me here today. It's a pleasure.
So as we start off, particularly with a closer look at Nigeria's north, the current statistics reflect that, COVID-19 pandemic, COVID-19 pandemic, the humanitarian situation has exacerbated statistics on infant mortality, particularly in Nigeria's north. From your close work in the country, give us a vivid picture to some of these numbers, particularly about nutrition, lack of nutrition, and lack of access to basic health care.
Right. So I have been in Nigeria for 2 years. What I observed is, like, in Nigeria, still 1 out of 10 children under 5 will die before reaching 5 years old, right? And this is based in a lot of inequalities. It's not the same. The country is very different, right? So as you said, in the northwest, northeast, the indicators are worse than in other parts of the country. Why is that? Why we think this is happening? The first one is because the health system is very weak, especially primary health care. What I mean for a very weak health system is not enough doctors, not enough nurses, poor infrastructure, not enough drugs, etc. Right? So if you have a weak health system, your indicators are not good. The second one is for the inequities, and especially in the north as well, the lack of access to certain areas. And you guys have discussing, like just now, about insecurity. So this is the 3 factors that they result that the country still has a high infant mortality and under 5 mortality. The country, though, is doing progress, right? The indicators are now better than 5 years ago. However, is this progress enough to really achieve the targets that we have as a country, as Nigeria, right? Still, we have very low immunization rates. In a place like Sokoto, the Penta 3 coverage, like is our main indicator to see immunization, vaccination, is only 11%. So this is extremely low, right? It's one of the lowest places in the world. 5 years ago, it was 7%. So the progress is there. The country is moving in the right direction. We have a strong leadership, etc. But the speed should be accelerated, let's say. This week is the World Immunization Week. So it's a great opportunity to discuss again about vaccines and how they can save lives.
So what are the attitudes, particularly in states like Sokoto that you talked about, the attitudes, towards immunization that militate against, embracing a more wholesome embracing of immunization for children?
Look, the immunization program in the world was launched 50 years ago this year, right, in 1974. And this is like, let's say, like as an old marriage, right? After 50 years, maybe the love, when we were kids, our parents were vaccinating, all of us, right? And at the time, 50 years ago, were only like 6 vaccines. Now we have 13 up to 17 vaccines in many places. So what we are seeing is in the last years, especially since COVID, people are not in love anymore with vaccines, right? There is a lot of noise around them. We see these pastors talking about vaccines. We see like resistance to COVID-19 vaccines or to the HPV vaccine. So we are seeing this a lot, especially in rural areas where information is not around, when there is a lot of misinformation, mistrust. This is rampant in communities. So we really need to address that. We really need to fall in love again with vaccines and with our children, right? So how we can do that? And I think the key there is, especially in the north, but as well in the south, is like what we are doing as Unicef is we're working with the communities, right? We're working with traditional leaders, with community influencers, with people living in the communities and having discussions, having dialogues with them. Why don't vaccinate children? And I think really we can carve that. We can change the situation. I really believe that.
Are you considering some of the exploring our fault lines to the advantage of the children's healthcare? For Nigeria, our fault lines border on our religion and ethnicity. So how much of engagement are you doing with the localities or the local community in terms of engaging them through their culture as well as the religious organizations? Because these 2 things are very important to an average Nigerian.
Correct, and we are seeing that very clearly, right? If your pastor, your emir, they don't endorse a vaccine, that's not going to happen, right? We are seeing that. So we are doing it. We were like a couple of weeks ago with the Sultan of Sokoto, for example, right? And this is one of the things that we discussed, how he can help to really promote vaccination, right? And we are trying to change the way that we are working. So, for example, with the government, we were discussing, you know, that there's still like a polio variant in some places in the north. So how we can respond to that? And one of the challenges is like some of the vaccination teams, they were not accepted by the communities. They didn't know them. They didn't know why these people are coming here with vaccines. They came already many times, right, with vaccines, so there is some diseases there. So what we're discussing is like, well, the vaccination teams, they need to be chosen by the communities, people that they trust, right? So I think like bringing back this trust in I mean, 50 years have already passed, but we have 50 years ahead, right? We still have many diseases around. And what we see, well, vaccination works. Just think in the diphtheria outbreak last year. Do you remember in Kano that last year there was a lot of diphtheria outbreak, a big one, even in Lagos. With the vaccination campaign, they stop. So it works. The issue is like how we convince, how we work with the communities to do that. So this is our key priority, actually.
So the elephant in the room with conversations like this is usually, why is Unicef interested? And I'm trying to relate the sentiments of people out there, right, so that this conversation really hits home with them. They're like, why is Unicef interested in this? It's our business. Let us do our thing our way. And they start thinking, what is the need for UNICEF anyway? Is there something cynical going on here? There must be some conspiracy, because nobody just shows you love out of the blues, right? Why are you showing us this love in quote? So when you use the example of we need to fall in love again, some will say, well, love is a choice. I'm choosing not to fall in love for now because and you know, COVID-19 came, right. There was that debate around vaccines. For some, it demystified vaccination. Even within the science community, there's still diverse opinions. There's no unifying, school of thought. So answer those people who always wonder, what is in it for UNICEF? What is UNICEF doing in Nigeria? Are you doing something cynical? And again, these are sentiments that are out there. So I'd like you to speak frontally to those people this morning.
Right. So first of all, about UNICEF. So UNICEF, we are part of the UN, and we are the ones that we want like every child can survive and thrive. That's our mandate. That's why we exist, right? And I don't know if you are responding. I'm seeing here, you're smiling. But
these are things people say, and you know we're in touch with social media from time to time.
Right.
So we want you to just demystify that right here on the show.
Yes, we are in every country where a child, so in every country, it's not only in Nigeria, we are in Africa, we're in Europe, we are in Asia, we're in every country trying to ensure that every child has a right to survive and thrive. Right? That's our mandate, that's what we exist. I'm a medical doctor for 20 years and I have devoted to this, right? It's like how we can get children to survive. What is our role here? Our main role is like to help the government to make things happen, right? Of course, here we have a strong leadership, things are moving, etc. But we always need help. You know, you can do. What is this this saying that it says you can, if you want to walk far,
go with people.
Go with people,
fast,
right?
Go alone.
Correct, right? So that's our idea. So for example, we support the country to bring the vaccines to the country. We have a very good logistics on that one. We have a good machinery on the communities, and we are supporting that, right? We are doing trainings. So this is what we're trying to do. You said love is a choice. You're fully right. But when you're in your honeymoon, when you just married, love is all everywhere, right? After 50 years, it's more complicated to have that love back. So how we can fall back in love, and especially when you have COVID, you have so many things that in your history, right? It's like after 50 years of marriage, you are like it's a gold marriage. I don't know what is the
golden.
It is the gold, yeah.
50 is golden jubilee.
Okay, something like that, yeah. But but for our children, they don't know about the 50 years in the past, right? I have like two daughters. Of course they are vaccinated. Of course I love them. But how people can understand that this is not something from the white man saying you need to vaccinate. This is something for, but we know it works. We know meningitis outbreak in Jigawa, that it's happening. Maybe it's not in the news because vaccine is working and we're stopping it.
Okay, so let's take it from where you are right now to the future. Right. For piggyback from where he stopped, that there's this, conspiracy, some sort of that, okay, they have something on their back, they have a bad plan for our people, And that's why we want you to break it down and demystify all of this. Maybe you tell them, the people that are asking these questions, some of these diseases and what it portends for the children in the future.
Right. I would like to look in the other way around. So,
Okay.
like, imagine the future where these diseases that they don't exist, right? So just think, for example, a future without cancer. I'm thinking now in the HPV vaccine that was introduced last year. Just think in a future without malaria. And this year, the country is going to start at the end of the year with the malaria vaccine.
That sounds nice.
Yeah, and imagine that, right? So let's think, we don't have a vaccine yet, but let's imagine a future without an HIV as a disease, right? We don't have vaccine for that. But we need to look forward for our children and for ourselves, like how the future can be different. Like some diseases were already eradicated, right? Think in smallpox. It doesn't exist anymore. Polio, there is still a little bit of polio here and there, but it's almost out of our picture. And remember that 40 years ago, there were these people that they couldn't walk, right, because of polio and dying. So I would like to think on that future, right? How we imagine Nigeria without malaria, how that would be, right? Like you don't have this recurrent disease, your children are healthy. So we can change things with vaccines. In the last 50 years, we estimate that more than 150 million lives have been saved. That's a big number. I mean, it doesn't maybe say something to the people listening to us now. But just imagine in this future, where no malaria, no cancer, no HIV even maybe. I think that could be an appealing thing. I don't know if the audience would relate to that, but...
Well,
it sounds nice.
Sounds nice.
Yeah.
Brilliant. But you didn't quite answer Kayode's question. I was hoping, for you to tell us what's in it for Unicef. Because the sentiment is strong in Nigeria about the interest of Bretton Woods institutions. But maybe you would answer that while you also answer this next question, which is, getting to the heart of the matter. Earlier on, you were talking about low universal immunization coverage, particularly in northern states. Speak to this, because I've had cause to do some reports about attitudes to orthodox institutions. We find that in most of our rural communities, the women would rather patronize a traditional birth attendance, some of them for efficacy, but some of them just because that's what they can afford. What do you find in this area in Nigeria's north? Is it the same, and is it because they do not have access to primary health care?
Okay, let me start with that, and maybe I will come back to UNICEF. The first one, clearly access and availability of services is an issue. Access, it means like you are able to interact with the health sector. Nigeria is now the country in the world with the largest cohort, the largest number of zero-dose children that they have never been vaccinated, right? Never been vaccinated.
Nigeria has the highest burden.
It's 2.2 million, right? So that they didn't get any vaccine. Why is that? So, and this is actually a proxy for us of multidimensional poverty. If you have not been able to have even a single vaccine, likely as well you don't have water, or you don't have good nutrition, or you don't have sanitation or a school eventually, right? So, and this happens a lot in the north, in the rural areas with a weak health system and difficulties on access, but as well happens in urban areas. I just went to Bayelsa last week, and we were discussing that these riverine communities, it's very difficult to access them, right? And there were like more than 20,000 children that didn't have any vaccine. So, for example, as UNICEF, what we did is to donate 6 ambulance boats. So now the health sector can go to these like very difficult to access communities in Bayelsa. I mean, so this is some of the things that for us, the most important thing is leaving no one behind, right? I think when development comes to a country, the country moves, the families move, the children, the situation improves. But there is always people that they are left behind, right? The ones living in very remote areas, the ones living in urban slums, in the Makokos, etc., right? So that's why we exist, to trying to leave no one behind. I don't know now if I got you why UNICEF needs to exist, but this is a little bit what we are trying to do.
And that's interesting. So it's important to tackle these issues, so no one is living off conspiracy. These messages go around fast.
Yeah.
And you know what they say about these things, they move fast. So it's important to move along with them with the right information, right, and ensure that everybody is on the same page. But let's talk about malnutrition as well. So vaccination, this is the vaccination week or immunization week, as the case may be. So from time to time, we'll be bringing up these issues to ensure that people know about it. But also malnutrition, because they sort of go hand in hand, right? You get vaccinated, but you also need food.
Correct.
And I know that the MSF had said that more than 500,000 cases of severe acute malnutrition was being experienced in the northwest region of the country. 854 children admitted to its facilities last year died within 48 hours of their arrival. This is a tough one. I mean, even reading this alone, you just picture that, and you can literally break down thinking about it. Is there any way out for us regarding this?
Okay, that's a complex one, right? Because when we look to, well, first of all, just to say that what we are seeing is the same data. What we are seeing is like the admissions of severe acute malnutrition, especially in the Northeast, have even doubled compared with last year. Right? So we're seeing this data from January, February, and March. And this is a huge concern for us, right? It's like, because these children, they need what we call RUTF. It's ready to use therapeutic food. Yeah. The food that can save their lives. When you are like severely acute malnourished, your life needs to be saved with this specific food. And we're seeing that increase. Normally, we have a frame for malnutrition. There's the 3 A's: affordability, access, and availability, right? Availability is that food in the markets, right? Access, can you go to these markets? And affordability, can you pay for that food, right? So what is the cause of this, right? So one could be obviously the crisis, right? And the huge number of children and families that they are now in poverty, right? That has increased for different reasons. So is that food in the market, but maybe they cannot afford it, right? Can't pay for it. And this results in malnutrition. And the other two ones as well, both availability of food and access to the markets can be challenges. So we're quite concerned on that. We think, like, as in public health, we always think prevention is better than cure. Ideally, we need to be working in prevention ahead of the lean season, right? Having the crops, etc. Having like social protection networks, right? To avoid that the child arrives to this severe acute malnutrition, where when then all your vaccines and everything, they will not work on you, right? You will get measles, you will get malaria, and this can kill you. 50% of the under 5 mortality has as an underlying cause malnutrition. So yeah, this is a really concern for us. We are working to try to make available RUTF, especially for the Northeast and the Northwest. But yeah, this is costly and it's not easy.
So I'm wondering what kind of, because there's a lot going on in the North that is very disturbing and concerning, from insecurity now to issue of vaccine to malnutrition. Like there's an epicenter for some of these very disturbing social and health issues. So when you have conversations with the government officials, what are they telling you and what are you telling them? Do they have a sense of urgency? Do you see it in their eyes? And how do you push it for them? Because at the end of the day, we're trying to save lives of our children here.
Correct. I do. I think so. It's very much in the agenda. I went with the Minister of Health to Sokoto a couple of weeks ago, right, to assess the situation on the ground. And I think you're right. I mean, one of the main issues is the inequalities. But classically, I think that in Nigeria, the response to the different, and I mean, I'm not from here, but I will give you my opinion, it has been equality, right? So the same for the 6 geopolitical zones, etc. But maybe it's not needed equality, but equity, right? That we respond to the different needs of different states or different people. It's not the same, the needs that we can have in rivers, that the needs that they can have in Zamfara, right? So I think we need to think more on this equity, with these equity lenses. Our response, even in the health sector, is going to be different in Kebbi than in Bayelsa or Port Harcourt, right? In different places. And I think that that is there, the sense of urgency is there. I think we're trying to accelerate the support, right? Especially in primary health care. We need more primary health care centers. And now the minister has launched this initiative of the 17,000 primary health care facilities in the country. So move from 8,000 that now they are functional to double them in the next 24 months. So I think the sense of urgency is there. I think we need to do something. If not, the indicators are not going to change, right? The zero dose, the malnutrition, the under 5. Neonatal mortality, newborn mortality is the babies that they die the first 4 weeks when they are born. Didn't change, that indicator didn't change in the last 10 years. Any progress on newborn mortality. So we need to do something, and quickly, right? Because we are losing a tremendous human capital.
Why is that not changing, that particular data, the neonatal mortality?
Because it's more complex. So to reduce neonatal mortality, you need to have a well-functioning health system with a good referral system, with a good neonatal UCIs, right? Intensive care in a secondary hospital. So you should be able to identify a newborn born in the community. 50% of the deliveries of the births in Nigeria are happening at community level. 50%, 4 million babies every year. Right, that's massive. So if one of these ones is complicated, you need to be able to identify that, to have a good referral mechanism to send that to a primary healthcare center and eventually to a secondary hospital. And that link is weak. So to have that, you need a strong health system, right? With a good communication, doctors, referral mechanism, community health workers. And we don't have that. In the last 10 years, any progress. We hope as well that it's a priority for us to try to change that.
Well,
I'm optimistic.
No, obviously, we can tell.
That's the name of the game. We know we must sell hope and remain perpetually optimistic. But I wonder if under the Minister of Health's program for the provision of 17,000 primary healthcare centers, that the humanitarian situation has been covered, because we wonder what continuing health looks like for Nigerians in IDP camps, millions of them in the north, who reportedly live in squalid conditions. And with the rains coming down on us now, the malaria situation may heighten. So I wonder if the organization UNICEF is, responding to that situation there, and if the program by the Ministry of Health that you are partnering with also covers the IDPs.
Yes, of course, IDPs is a priority for us because of the leaving no one behind, right? So we are working on that not only in the north, but as well, for example, in Benue. We have a program with IDPs, with displaced people. I think, as you said, we're going now to the rainy season. The risk of outbreaks, it's certain there. Cholera outbreak, for example, when you have poor sanitation of poor water, right? We have as well a risk of, as I mentioned earlier, meningitis, because it's a season. Since January is the season of meningitis outbreak in the meningitis belt in the north of Nigeria. So IDPs are extremely vulnerable to all these outbreaks, etc. Right? So we think we need to do an integrated approach, and basically working at primary healthcare level and at community level. When I talk about primary healthcare, I include community health, right? So to have CHIPs, the community health influencers and promoters at community level, to be able to treat basic conditions at community level. The main killers of under 5 or children under 5 are 3 main killers: pneumonia, diarrhea, malaria. Now the 3 of them, 2 of them now they have a vaccine for rotavirus for diarrhea, pneumococcal for pneumonia, and they have easy treatment, right? For diarrhea, ORS and zinc. For pneumonia, amoxicillin. And now we have malaria. Malaria, we don't have the vaccine yet. We'll have, hopefully...
I understand it's been distributed in Africa now.
Yes, a few countries already started, like Cameroon was the first one a few months ago, and in Nigeria will arrive hopefully by November, only in a couple of states, because we need Nigeria has a lot of demands, right? 8 million children per year, new children, so you need a lot of vaccines. So they will start small this year, and then we'll roll out next year and the following. But it's not only the vaccine, it's about the mosquito nets, right?
Well.
It's about having easily accessible treatment at community level, at primary healthcare level. So I do agree, that's a concern for us over the next few months, ahead of the rainy season. And it's a priority for us, and I believe for the government as well.
So this integrated approach, would it be the provision of makeshift, treatment clinics for the IDPs, because it's evident that they do not have access to primary healthcare centers because of displacement?
Yeah, and as well outreach. We support as well the outreach.
With
right?
outreach?
Yes. We support that. One of the plans for this year is what we call the big catch-up. So trying to do a big program on outreach to ensure that the children that they were missed during COVID, right, the last couple of years, they have access to the vaccines. And this is an integrated manner. When we support outreaches, it's not only to vaccinate, as well as to go with the MUAC. I saw the picture there, like to see if there is malnutrition, to give as well supplements for pregnant women, to do ANC consultations. It's challenging, but it can be done. If there is a will, there is a way.
There's a way. So it's National Immunization Week from April 22nd to the 29th. So it's going to be a busy week for you. I look forward to seeing some maybe innovations when it comes to immunization. Maybe there could be an app where, you know, you can just download, register your child, and then, you know.
I agree.
Or maybe a short code. Something like that, because it can also help. Once people see it's easily accessible and they can have their children on the app, you can track the child, you can get like a notification, like this child is meant to get the immunization next week. You know, everybody's on their phone these days. I'm just giving my 2 cents to the National Immunization Week, essentially.
I like that. I think we need to bring that's why technology exists, right? So let's use it. One of the priorities that we have is to increase the visibility of vaccines. The country receives 475 million doses of vaccines per year, right? More than 200 shipments of vaccines. All of them, by the way, manufactured outside of Nigeria. So as well, it's something that needs to change, right?
Yeah, and manufacture them in-house.
Let's manufacture them here. And I think I was discussing about that yesterday. I had a couple of meetings, so that we hope really that this is going to happen. Maybe 1-2 years, right, or 3 years. We'll see. But one of the issues, like, can we track the vaccines since they arrive up to the last child, right?
Exactly.
So we'll talk about this app that you are suggesting to see how we can make it happen.
Absolutely.
And perhaps, you know, reward Cardi for copyright.
I've been immunized already, so that's good rule.
All right, we want to thank you so much, Mr. Eduardo Saladis, Chief UNICEF Country Office, Nigeria. I hope I got that correctly.
Yes.
Thank you so much for coming on the Morning Brief. And we hope that the results will be discernible in the coming months, you know, rather than years, in the results of reduction of infant mortality and maternal mortality in Nigeria's healthcare system. Thank you so much. Do we have time for some of your comments to the program?
Oh, yes. That's what we live for, guys.
Yeah, so from
I think we should go way back. There's the one that, I don't know whether we still have that.
On electricity, right? From
electricity. KZA 008 says the electricity situation in Warri and its environs is more than pathetic. We barely get 2 hours supply of power in a day. Are you in band A or band F? I don't know what band you're in. I don't know. But we understand your concern. We're telling the authorities it's a sad one and it's pathetic. We must add that as well.
Definitely.
Kari, you have the next one.
Oh, yes. By the way, we have this video for one of our viewers. Really, it's the situation in Jos, the Plateau State capital. And this from Gozang David, Bauchi Road, after the heavy downpour. I mean, look at that.
More like a storm.
Goodness me.
But this is flood.
Yeah.
There's the
streets
deluge.
flooded. And
Seems to come with vengeance.
Yeah, and you can see the trash on the road. So obviously the trash was not disposed properly. So some of them perhaps blocking the drain, some of them disposed indiscriminately. So this is a conversation we need to have. This is just the tip of the iceberg, as they say. We're not fully in the rainy season just yet.
Yes.
So we need to get our acts right now.
Yes. And this next one is from Law Alpha Cross from Abba, Law Alpha C from Abba, who says, I'm scared concerning entrenching state police in view of obvious drawbacks. Example, when the EFCC declared former Kogi State Governor wanted, the IGP had to withdraw security officials attached to him. It was said that the present governor shielded him from arrest. What do we understand from this? State police will protect corrupt politicians at the stage level and douse relevance of same at the center. Well, that's what former President Goodluck Jonathan says Nigeria must address collectively, the potential for abuse of the police, whether it's at the state or at the federal level. Well, this is where we drop the anchor on the program today. Thank you so much for watching. We will be back again tomorrow. I am Bukola Koka.
I'm Jeffrey Uzong. Have a good day.
Always stay informed, okay? Don't just live on conspiracy theories. That's why it's always good to be on the Morning Brief. I'm Kayode Kikelu. Goodbye.